The international development sector is facing a crisis. Vital programs are closing, and access to essential services is at risk as major funding sources vanish. The disruption is affecting humanitarian aid, healthcare delivery, and educational programs across multiple countries. While new solutions and funding sources will take time to develop, and there's no magic bullet. But my guest today shows us there's still room for hope. She proves that even small steps, small actions taken thoughtfully can spark real and lasting change. Hello, everyone. Welcome to Progress Reimagined, a show that explores innovative ideas, technologies, and emerging economic models that put humanity and our planet first. The show challenges assumptions to reshape how we think about progress and prosperity. From mobilizing 22,000 healthcare volunteers during COVID-19 to bring healthcare technology to refugees across Asia Pacific, guest today is a force of change in digital health. She's the founder of Equitech Collective, an advisor to the World Health Organization, and was recognized as among Singapore's 100 women in technology. Please welcome Ling. Hi, Ling.
Hi, Kathleen. Glad to be here.
Thank you for joining us. We met in Bangkok, and it was such a pleasure speaking with you and hearing your talk. So I'm really excited about today's discussion. First of all, can I ask you, what is that one thing in your field that made you people believe it's true, but doesn't hold up under scrutiny?
Yeah, Kathleen, really good to reconnect as well since our time in Bangkok. I think one thing that is a commonly held belief, but to me doesn't really hold up to scrutiny, is this idea that there isn't enough. There isn't enough to go around. We don't have enough money to feed everyone, or food, nutrition, or that wealth is something that really should be in the hands of the exclusive for the few. There isn't enough to provide for health and education, shelter, and these basic needs that everyone in the world needs. Even though we do have a sizable population on this planet that's growing, with technological advances, we have seen that we have so much more resources today to deploy to make sure that everyone is well clothed, well fed, and have the ability to thrive and flourish. I think this mindset of scarcity is really something that trips us up a lot, even though we live in an age of abundance.
I see. Thank you. Maybe share a little bit about what's Equitech?
Yeah, I'm very happy to. Equitech is a team of technologists. We are software engineers, product managers, and designers who are committed to building technology to advance equity in healthcare and education. And we were founded because we realized that small differences and changes can actually make a big impact if they're applied at the right places. So we build software and technology for the development sector, but also in transformative healthcare models. We try to support impact-led organizations that are delivering healthcare in a scalable way to many people, and we use technology to accelerate and scale the work. Equitech deploys a product called Medibot. It's an AI clinical decision support tool that's integrated with WhatsApp in Timor-Leste. So we are in a pilot phase where we have piloted this with a group of doctors, and we found that it's very effective in augmenting care for solo practice GPs who operate in very low resource settings where they are often the only person serving thousands of patients. So there are clinical guidelines that are available, published by the Ministry of Health, which we train our chatbots to ingest, and that in turn becomes a companion for Timor-Leste doctors when they see patients. Timor-Leste is a country where there are about 1.5 million people, and about only a third of babies actually born with midwives or professional healthcare support. So in terms of the quality of care and need for much better access to care, there's a lot of acute needs in Timor-Leste that could be helped with technology.
Can we talk about why we need kind of impact-led ventures, and why is this work important to you?
Yeah, I think people have different terms for it. I think some people call it social enterprise, some people call it impact venture. But fundamentally, what's the similarity across the work that we do, or my colleagues do, is really that it's about having profit serve purpose. And that means that when we come up with business models that are generating income or revenue, it is directed or reinvested into the purpose that we serve or the social mission that we serve. I think traditionally, most companies are started primarily first to generate profits. And perhaps if they're successful and they have surpluses, they might consider starting foundations or as part of their CSR efforts, try to redistribute some of that to support nonprofit organizations. I think the model that we are really keen to experiment with is to flip that around. What if we actually start with a purpose first and then figure out how to make profits or generate revenue and income to support that purpose? So I think fundamentally it's about clarity of the cause and the mission that we're serving, and then figuring out a sustainable way to build teams, support livelihoods, and bring in the kind of revenue, capture a part of the value that we create so as to reinvest that into the social purpose we serve.
That sounds really, really interesting. Like you said, there's always the focus for the longest time has always been profit. How do you, right? Isn't it? We think about how to make money first before thinking about passion, most of the people. So let's go back to Equitech Collective's initiatives, from refugee EHR systems to coding bootcamp. Which project has the most unexpected or meaningful impact?
Equitech does a number of things. We deploy electronic health records along the Thai-Myanmar border to support migrant health. We also deploy AI tools and chatbots to countries like Timor-Leste that could really benefit from clinical decision support that is augmented by AI. We also launch coding bootcamps for refugee and migrant populations, youths particularly, who could benefit from access to better livelihoods and career prospects in the long run. A lot of what we do on the nonprofit arm of Equitech is to do with using technology in an impactful way to either scale access to education or healthcare. And one of the unexpected benefits of the impacts that I think really came up is not so much, how many people are using the system or how many people are necessarily benefiting as direct beneficiaries of programs, but the kinds of sustained, deep personal growth that we see our youths undergo and that transformation. And what that looks like is going from, I've never heard of computer science or coding, to being able to code and even studying or pursuing a computer science degree in a university. And one of our refugee migrant students who was part of our coding bootcamp eventually went on to study computer science in a university. Even though when she first started, when we first met her, she's never actually heard about coding or software engineering.
Mm-hmm.
I think that kind of personal transformation, seeing a sense of possibility where the circumstance could be fairly dark and discouraging, bringing hope to entire communities, I think that's one of the most unexpected impact. That is a lot less measurable, but I think in the long run is really what could transform communities in a real way.
Mm-hmm, mm-hmm. During my Bloomberg days, we will invite children that are in orphanage to visit the newsroom and to sit in the chair of the anchor to practice about delivering news. And I think the impact goes beyond just visiting a fancy office, right? It's about seeing your oneself in the chair of what could be. I think that's really important. Once you can see it, once you can visualize it, I think it's easier to take that step forward, isn't it?
Yeah. And in fact, once you can see it, you could then do it and you become a role model, right? For a lot of these youths, one of the most unexpected impact is what happens to their friends. So the first cohort that we ran the coding bootcamp to eventually actually inspired subsequent cohorts to join, and they see what their friends can build. They were building personal websites, their own portfolio of, software and products. And that has been really beautiful to see that they can imagine for themselves a future that's very different from what the kind of cards that were dealt to them, and were able to also inspire the peers and the friends to pursue a trajectory that was otherwise not available to them.
What got you interested in building Equitech? And it just sounds amazing of what you do and your achievement and being able to make impact in such a meaningful way.
I don't think there's one particular, life-changing event or incident. I think it's very cumulative over time. I started my career in the public service in the Singapore government. So I was very much a policymaker and really looking at systems change from a policy perspective. And a large part of my career is in how do we create defaults that create the maximum amount of good and utility. It's kind of, in some ways, utilitarian philosophy of doing good. It's creating systems that maximizes public good. And that has been my journey for 8 years across multiple roles within the Singapore government. But something that I realized is that there's a lot of small changes we could make in the system that requires us to fail cheaply, that requires us to experiment in a way that in bigger systems might be more challenging to pull off. In government and in larger corporations, of course, everyone's trying to embrace innovation, and everyone knows and understands intellectually the need to try things out, double down on what works. But it's really easier said than done, right? Because the risk appetite of someone who works in a larger corporation or a government is very different. And there are certain bureaucratic interests that people need to take into account, and that has bearings on people's individual careers. I think the beauty of starting Equitech and doing this as sort of a social enterprise or impact-led venture is that we can really start small. And I often believe that small is beautiful and, big only if necessary. But a lot of things can be achieved with very, very small changes, small teams. And when we start small, we can also fail quickly and cheaply. Because really figuring out what works is not going to happen unless we have that room to truly experiment thoughtfully and intentionally. It requires a very empirical approach, right? So with policies, with big changes, it's very hard to say, oh yeah, let's just try it out. Once you roll out a policy change, it's going to affect thousands, if not millions of people. So there is, of course, room and space for that kind of big scale policy changes, but there's also a need for, I think, smaller scale experiments that could point the wider ecosystem in the right direction. That's why I started Equitech. Really, how can we create that room for experimentation and build a critical mass of people who are willing to take some risks and to fail in small ways so that it could point us to broader directions of where the larger ecosystem could go. I also started Equitech because I see that it's possible for technology to lead to more equitable outcomes rather than to lead to a more unequal world, which is really the current default. Technology is one of those forces that, given any existing status quo or mechanics or logic, it just accelerates and brings it to its logical extreme, right? So if your underlying social structures are fundamentally unequal and has a strong bias towards favoring the rich or the wealthy, then technology is only going to make that even worse over time. And we're already seeing that, right? So billionaires' wealth over COVID during the pandemic actually increased more than it had compared to the past 23 years, more than it had in the past 23 years. And that is actually a staggering statistic. And if we don't do anything about it, technology is only going to keep compounding that inequality. So what could we do in the opposite direction? Could we use technology intentionally to reduce inequality and mitigate its effect? So that's another reason why a team of us came together to look at building equitable technology.
You mentioned about fail cheaply in a way that governments and institutions don't usually have the capability of. Can you share some examples of how you failed, if you don't mind?
Yeah, absolutely. So Equitech is still pretty an early stage venture and social enterprise. So a lot of the work that we do are still experimental and still in the early phases, right? But some ongoing learnings and experiments is when we deploy technology to lower resource settings or lower middle income countries, it is very tempting to think that we know better when in fact the local community has a lot of wisdom and is a lot closer to the ground truth. And any version of technology or solution that we bring to them will have biases that come from our own experiences. That may not mirror what the local communities see, right? So one early mistake is that we were moving too fast. As a group of technologists, we do come together and we are used to a certain momentum and cadence. Once we hit the ground running, we bring that kind of momentum as well to the local communities we serve. But sometimes people do prefer a bit more alignment, a lot more really understanding of the nuances of cultural context, right, before we double down on a particular direction or solution. So that trust building is first and foremost, by far the most important thing we learned to do. And we learned that in the early days when we got feedback like, oh, you guys are moving so fast. We really keep catching up. And we took that to heart. We really listened and adjusted. how we worked with the local community, finding a pace that was comfortable with them. So that's one early learning. I think another kind of experiments we are really running a lot on now is AI. In our deployments, AI, understanding what the boundaries and limitations are with AI, how comfortable doctors and nurses are in adopting this technology, and under what circumstances would they actually use it. We've failed several times and are only starting to find our footing in some of our deployments in low middle income countries like Timor-Leste.
Mm-hmm. AI is such a hot topic right now. And you mentioned earlier, if we are in a society where billionaires can kind of double their growth or double their wealth in such a short period of time when the rest of the population is suffering, technology really plays a part. This technology can also be seen as a multiplier in some ways, but at the same time, it can go to another direction to be really a force for good. So just curious your views on that and how you're utilizing AI to make a difference.
Yeah, I think there is general consensus that AI is going to be truly transformative. It's going to be a real disruptor. It's already changing how people work. In some cases, and there was a New York Times article as well talking about how AI is probably going to make even doctors unnecessary in the future. I won't go as far as to say that, but I do think that AI, when applied well, can actually scale the trust and presence towards doctors who are delivering quality care. In the case of healthcare, the intentional use of AI can augment and scale and amplify good philosophies of practice in the healthcare sector, whether it's by doctors or nurse-led teams. It's not to replace them, but actually to help more patients access them. Like already, so many doctors are backlogged, right? It takes 2 to 3 months to even get a time with them. There is a real shortage in healthcare workforce globally, and that includes Asia. We are seeing falling birth rates, shrinking healthcare workforce at a time of aging population where the healthcare needs are going to be growing and mounting, and at a time when budgets are being cut. So this past week has been a very, very, in some ways, depressing week for the international development sector following moratoriums and funding freezes. That's signed off by, the Trump administration. And people are really having to think creatively about how can they provide the kinds of healthcare services with much less resource. And AI, when applied well, can scale a single doctor and enable this person to serve thousands of patients. Whereas in the past, this person might only be able to serve a dozen or a few hundred patients at a time. So I'm very optimistic about the potential of AI. I am a bit less optimistic about whether people are able to use it wisely and to maximum benefit. But I think we will continue learning. What we've learned in our own experiments in Timor-Leste deploying AI is that trust building is extremely crucial. Understanding what AI is unable to do or what doctors aren't comfortable with using AI for. And a lot of technical challenges that have to do with accuracy of translations. How do we adapt AI such that it can be accessed by people who speak different languages, various ethnic minority languages that aren't readily accessible on Google Translate? Right. So there's so many fantastic applications and use cases for AI. The one that we have built is really just one of them. It's meant to support doctors, right? For doctors who don't have sufficient access to the latest medical knowledge, to have something that's right there on their WhatsApp chat. They can actually speak to an AI chat that's convenient. And it also allows them to ensure that they have access to the latest clinical guidelines published by Ministry of Health, and it's contextual locally, right, to the conditions of Timor-Leste. So for example, if they're treating a diabetes patient, our AI chatbot would not return a drug like Ozempic because that just doesn't exist, right, in Timor-Leste. Or even ECG, because that technology is very, very rare and not readily accessible in Timor-Leste, even though in the other parts of the world it is. So it's about contextualizing care so that local doctors could provide much more timely and relevant care. There are other use cases beyond what we've been building for AI that I think is tremendously powerful. Like I've had some colleagues in the digital health space who's looking at anemia detection using AI, and that's being launched in India to millions of people. Some friends are working on diagnosis and triage using AI. And of course, not to mention AI is getting better at radiology than radiologists at interpreting radiology lab results. And so all these new use cases of AI, I think when put together, can really lead to a world where possibly more people can access healthcare without there being a commensurate rise in healthcare workforce or manpower.
Your work, from working for the government to Equitech, all has a strong focus on equity. Was there any particular experience that shaped this commitment? Why is equity important to you?
I think for the most part, I'm just voting with my feet. I think equity is both a personal value and also a cause that has good positive externality in society. It's also I think it speaks to a very innate want and desire among people for fairness. And we can complain about how the world is unfair. We can complain about how the world is inequitable, but we can also do something about that. For me, my very personal encounter with inequity was as a child. I spent some time in China, and I think one time I was just in a car and a little girl was knocking on my window and was begging for money. And I was just very, very curious, like why. I was also 5 at the time, and I was just wondering, why do I have so much more than she does? And I was also aware that even if I gave this little girl all the food I had on me, like that's not going to help her after today. Right. So I think that was a very early childhood encounter that sort of stuck with me. But along the way, while I went on to college, while I went on to work, sort of having to revisit that again and again. I spent some time in Silicon Valley, San Francisco, Palo Alto. What was striking to me was this was a place where there was such a concentration of wealth and ideas, talents, right? You have the best and brightest going to Stanford, Berkeley, and all these great universities. And then just right outside of the campus in San Francisco and the streets of Palo Alto, you have homelessness.
Right.
And homelessness is almost accepted as a feature. Like people come to expect it, even though the narrative within the campus was, we've got to change the world, we've got to make the world a better place. And I started realizing that the kinds of problems that we were solving were really problems for the 0.01% rather than for the masses and people who really have a lot more need. So I think that encounter really led me to think. It led me to think that unintentional applications of technology and wealth is not going to change the world for a better place.
Yes.
So how can we really expand, I think, the circle of empathy and not accept that homelessness is going to be a feature in a community where we are so well-resourced? Like there's almost no reason or excuse for this to happen. In my mind, it's such a cognitive dissonance that I felt something should be done. And I started with myself, right? Like in figuring out at the time, consulting, working for Facebook, Dropbox, and all these companies were very attractive options. And as a college student then, it really got me thinking, like, how would I want to apply what I have? Whereas whether it's time, whether it's talent or skills, where should I dedicate these resources and gifts to? It was very clear in my mind that this idea of doing well and then doing good is not going to be a viable option, because I feel that in the end, there's really no redemption. You either commit to doing good and then figure out how to do it, acquire the skills and muscle to doing good, or you don't. The narrative of you've got to strike it out rich first and then think about doing good never really sat well with me, even though it was quite the prevailing narrative in the school that I was coming from. So I just sort of pursued that little thread, and then kept exploring, serving in different roles and capacity that led me to find out and discover all these wonderful ways of bringing people together and all these wonderful ways of connecting with the people I actually want to serve. Yeah.
Well, I think for many, including myself, it's always hard to come from a place of abundance when you're very used to thinking, I need to do certain things first before I pursue my dream. This lacking mindset, right? It's such a profound view, the starting point is really important, isn't it?
Yeah, I think so. There's actually a saying in Chinese. It's called 不忘初心，方得始终. And that means that if you don't forget why you started out doing something and your original intent, that will be a beginning and an end. You will get. And I have always took that to heart because, along the way, there can be a lot of temptations and distractions, right? Whether this is like, a career in this or, maybe wealth and prestige and status. But ultimately, I think if we go back to like why we started out doing this, why I even got an education, and just following what was really a calling and what feels correct and right. I think that would lead you to finding something that really is an end in itself. Like even if it fails, it's worth it.
Yes. I think for those that are just finishing school, thinking about what they want to do, or maybe someone who's looking for a second career or career change, and who are interested in the area of impact-led kind of projects or organizations or ventures, what kind of advice do you have for them? There's always invisible walls that we build around ourselves. What would be your advice for people who are thinking to make a difference?
Say dream big but start small. I think there is a lot of wisdom in starting small. Dreams are great, but there's also a fine line between dreams and delusions. The only way you can be honest with yourself is to keep checking yourself. And the only way one way you can keep yourself in check is sort of to start small and build that confidence over time in a very empirical way, an evidence-based way. Right? We can have lots of lofty dreams and we can try to effect these monumental changes, but who knows what kinds of unintended consequences we would have created. At some point, the cause itself becomes the thing that is driving self-preservation of an organization, as opposed to the beneficiaries or the real people, like living people who are actually going to benefit from your wealth. Right? So there is this real fine line between a dream and a delusion that I think if anyone is really committed to impact, starting small is a great place to start. And this could mean picking a problem that matters and then chipping away at, what are all these possible solutions you could come up with, and then testing it with a small group of people first before doubling down or committing more resources, including your own time, into what you think works. Yeah, I think that's one learning or advice that I would share with people who are likewise want to embark on this journey. And before you know it, all these little steps actually compound. And when you look back, you realize, you have actually built something pretty big. But they were all just made out of these small steps that we took along the way.
What's the you mentioned about intentional use of resources, intentional use of technology. What does the intentional use of resources, such as technology, play in a more equitable world?
Yeah, I think the first thing I'll say is that resources come in many, many different forms. A lot of people think resource means money or people. And that can be true. But there's also a lot of resources that people miss, right? There's time, there's ties, there's trust, there's, talents and skills of people. And there's also wisdom, right, in local communities. Even the people we help, we often say, we're helping them, but often I feel that it's the other way around. They are teaching us a lot of things that we otherwise wouldn't learn. And when it comes to intentional use of these resources, first being able to see them, to see that these things that people don't traditionally consider a resource can be resource as well. Equitech Collective, when we first started, all of us were volunteers, like most of us. And what did we bring to the cause? We brought a commitment to equity. We brought skills in technology. These are software engineers who would otherwise work for TikTok, Facebook, Google, but they will commit some part of the time to help the development field. So that's also a resource. And finally, local communities have their own context and familiarity with the problem area. That's the biggest resource, because if any chance that we would help to solve a problem, it is only possible if we understand the problem. And that understanding has to come from the local community, from the people who are affected by the problem. Yeah. So I think intentional application of the resources is in first seeing all the resources around us, and then really applying energy in the direction of the desired direction, finding the leverage points, what I call leverage points. These are places where if we just apply a little bit of effort, it could yield outsized impact.
What are some leverage points? I guess you mentioned about the number of resources that are not very visible in terms of, well, in the way the world works, because the main focus has always been capitalism, right? It dominates what we do, and money is the currency, is the resource. So for some people, perhaps it's hard to kind of see things beyond that, but they are actually all around you. What you're saying is.
Absolutely. I'll give you an example. I'll work with healthcare along the border, help refugees coming in from Myanmar into Thailand. There's a lack of healthcare infrastructure, including digital infrastructure along the border. A project that we've been working on with the local community is in designing and deploying electronic health record systems, right? And what's the resource in this case? The resource here is we have a piece of technology and a software, right? But that is not going to be truly embedded within this team or this clinic unless they are trained to use it or they have the capacity to learn to maintain it over the long run. So resource in this case is, could we inspire the local community to learn how to do, typing or improve their digital literacy? Could we work with them over a long period of time to build trust in the technology that we are deploying and give them that ownership, the sense of ownership, the sense that they could actually maintain it in the long run? I think the resource here that I feel is collectively being built. It's not something that we bestow, but it's really something that we try to harness together with the community, is actually curiosity. Number one, like how does this tech work, and how can we work with it? How do we train ourselves? Like having that curiosity is really important. And then second is hope, right? And this hope that we are all capable of making this building the system that's built to last beyond any particular tech team or beyond the shelf life of a piece of software. Such that even if the system is not working, like you have a much better team in the clinic that has now learned to type, that has now learned to work with technology, and you could find other solutions for problem solving in the longer run. I think that hyper-local approach to building capacity is really what we're trying to do through Equitech, and that is the key resource, I think, that we try to unlock.
So what kind of advice do you have for those? I guess we kind of touched on this a bit earlier. What kind of advice do you have for those who are looking to reimagine progress?
Reimagine progress. Yeah, I think reimagining progress takes certainly a lot of imagination, but I also think it helps for the imagination to be informed by actual lived experience. So for the people who are trying to do something, whether it's with a local community or whether it's with customer segments that you're trying to serve, is to truly get some lived experience. What are people feeling? What are pain points and frustrations that are being experienced by other people, and build that level of empathy, right? So that you could see potential solutions and possibilities in a very real way, not in an imagined way, right? I mentioned earlier that there's a very fine line between dreams and delusions.
Yes.
And I really believe that especially for people who sort of commit their career, usually we are to be honest, I feel very privileged in so many ways to be able to do this work. But I also see limitations, right? By virtue of the fact that we are doing this work, we can sometimes distance ourselves from the very people we serve. And I think finding those ways to really connect at a very human to human level and appreciate the challenges, if not trying to really, not in an intellectual sense, but a real way, right? To befriend the people we are serving. I think that's a good first step.
Building trust and connection. You mentioned that's kind of your early learnings in this journey. If I may ask you about how do you get the funding you need? You mentioned about resources that are around you. You can utilize a lot of resources that are not sometimes obvious, but I guess for a project to get to the size where you are now, how do you kind of raise funds, or how do you make it work financially?
Yeah, no, that's a great question. I think the scene is really changing from what I can see in the development field. When we first started, we had access to a number of project level grants that would help to catalyze and set in motion some foundational work, right? That allowed, our deployment of AI chatbots or electronic health record systems along the border to really happen. But when it first started, we didn't have those resources. I think what we had was a vision and the sense that this was possible and that we did whatever it took. Money came much later. Like funding came into being like maybe a year or slightly more than a year after we had that vision. So I'd say, don't let funding get in the way or the lack thereof get in the way. I think if you have a vision, there are ways to get it going even without funding. And I personally don't commit funding into something unless I feel confident that this can make a real impact. Because funding is actually a commitment it's an obligation. Funding is an obligation to deliver. It shouldn't be the thing that precedes vision.
Mm-hmm.
So that's the first thing I'll say about funding.
Mm-hmm.
The second thing is that there are real changes taking place in the international development space that is going to have seismic effect on how things work. A lot of foundations or NGOs, organizations that are traditionally funded by grants, particularly grants coming from the US, is going to see a much more challenging time ahead, both because of, of course, the ascendancy of Trump administration, but also because there's increasing awareness and preference for organizations that are able to be self-sustaining. In other words, not be completely driven by grant. And that means forces a lot more organizations to be more creative. How do we create enough value that we're actually able to capture a part of the value, even in very, very low resource settings? How do we build organizations for self-sustainability? I think that's the general direction I think the sector is going towards. Equitech was built from day one with the mission to be self-sustaining and not to be completely reliant on grants, even though for some of our projects, it is grant funded. And this has just been a great thing, I think, for the organization because it forces us to be a lot more creative.
Yeah, I guess this is such a challenging time for projects that are receiving grants from the US, especially if you can share your experience on how to build a self-sustaining organization and your advice to those that are really looking to be creative.
I think the first is, so for us, we have a for-profit social enterprise. Or impact-led venture that provides AI digital health solutions for public health clusters or private clinics in developed economies. So we work in Singapore, Australia, New Zealand, and surpluses from that go into our nonprofit that in turn serves low and middle income countries. The model we have here is, or the theory of change here is that if we could, through for-profit ventures, create enough value and capture a part of it, that forms the basis, right, or a recurring revenue that enables us to do the nonprofit work that really started all of this. And that's a model that is an ongoing experiment for us. We decided very early on that that's the financing and funding model we wanted to work with. Part of it was later also inspired by companies like Patagonia, which I really encourage a lot of us to read about. There's a book called Let My People Go Surfing. That's a really good book articulating the philosophy of the founder of Patagonia, how they commit to creating value through good quality products and capturing that value to support the sustainability cause and mission through the foundation on the side. So I think there are lots of models out there. Some tech companies like Airbnb have Airbnb and an Airbnb.org. I think that there's just so many different mechanisms. I've also seen companies that would commit to donating like 1% of their sales to causes. I think those are charters of features that allows them to bake in an element of doing good and corporate social responsibility or just really purpose-driven business as a DNA. But my experience, learning how to create value is really the first step. And that is not easy. Not easy, but I think it's very worth doing, especially in our climate.
Yeah, there's so many things that we talk about. I think it's going to be very helpful for the listeners who are working in the health sector or who rely on grants and also who are thinking about starting something on their own and making a difference. So how should people find out more about Equitech?
Yeah, we have a website. It's Reimagined.tech. And we also have a LinkedIn page. So very happy to share our links to you after this podcast.
We'll put it in the show notes. Well, thank you so much for taking the time to speak with us. Really appreciate your insights, Ling.
Of course. Thank you, Kathleen, for having me on your podcast. I enjoyed our conversation today.
Thank you. What stood out to you from the conversation? For me, Ling shows us something exciting, that we can blend business smarts with social impact to keep important work going, even when traditional funding gets tough. It reminds me of what book author Octavia Butler once said. There's no single answer that will solve all our future problems. There are thousands of answers, at least. You can be one of them if you choose to be. Thanks for tuning in to Progress Reimagined. Help us grow by sharing, subscribing, or hitting that like button. Thank you.